Well, good evening, IDM Scholar Society Study Club members, and I hope some of you, this is your first time to join us. And in behalf of Dr. Gina Pritchard and Dr. Tom Neighbors and Laura Hooper, I want to welcome you in joining us. I hope you'll be with us every other month, the first Wednesday from 8 to 9:30 p.m. Eastern Time. And tonight is very special to me and all of us because our special guest tonight is Dr. Stephen Masley. Dr. Masley has been my physician for the last several years, and I like to say he saved my life because he did. And I'm so grateful, and we've become great friends, and we've had him speak at many dental meetings around the country where he's been just so embraced by the dental community. But Stephen, thank you for joining us tonight. Stephen lives in St. Petersburg, as I do. So thank you for joining us, Stephen.
Oh, I'm really glad to be with you tonight. It's my pleasure.
Well, it's a real pleasure for us. And for Stephen and I, it's a pleasure just to be here because we just had one of the most serious hurricanes in history go through Florida. About an hour south of us, was devastating. And we're still remembering and thinking and praying for those people south of us. But it was very exciting last week. And Stephen lives on the water, which makes it even more exciting. But fortunately, his home and boats and everything were spared and no damage. So let me introduce Stephen, and then I want to just begin to ask Stephen questions, and know that we're going to give time tonight in our hour and a half for you to ask Stephen questions too. But Stephen is a physician. I believe you were trained at the University of Washington. Is that right, Stephen?
That's correct.
Yeah, outside of Seattle. And he's also a nutritionist, it turns out, and you can tell the story better than I can in a minute, Stephen, but he's a trained chef, which he did purposefully, knowing what he was going to be doing in his career that includes a very heavy emphasis as a physician on lifestyle and nutrition. Stephen is a fellow of the American Heart Association, and he's a fellow of the American College of Nutrition. He's served thousands of patients over 37 years, we counted up, as what I would call an integrative or functional medicine specialist in the medical field, where the idea is to look at the whole person and not just their chief complaint, but the why behind the cause and effect, the root causes. And so I don't know anybody in the world that spent more time looking for root causes, identifying and treating root causes than Stephen Masley has. In his research, which he's documented very heavily, the work that they've done on each patient, the results, the responses, the different treatment modalities, and come up with some very significant research. And these have been published in his books, which I highly recommend to you. The first one I read was called 10 Years Younger. And I know there's a story behind that too, Stephen, as he was doing a PBS special that was broadcast all over North America. In fact, Stephen, one night I was in a hotel room, and I think it was Calgary, at a meeting, and I turned on the TV, and there you were, and doing a PBS special on healthy lifestyle and nutrition. And so the first book I read was 10 Years Younger, and I've probably shared that book with more than 100 patients. I just stocked my office with that book and started handing it out to those that were interested in making changes and understanding metabolic syndrome and diabetes and these different issues we all are aware of today. But he's written several other books, including The Better Brain Solution, about brain health and the things that we're so concerned about cognitively as we age. The 30-Day Heart Tune-Up is the kind of the newer version of 10 Years Younger. He also wrote a book called Smart Fat, as we now learn that fat isn't the killer. It's more of sugar and refined carbs and refined sugars and carbs and oils, and numerous scientific articles. And he's appeared on numerous television programs, etc. I could go on and on, but I just want to thank you, Stephen, and then get right into our discussion tonight. I also want to, so I don't forget, to refer you all to Stephen's website, where he has blogs that are very informative that you should read, that he posts regularly, and it's Dr. Masley, dr.masley.com. And you can go there and see a lot of the information that he shares with the world. But Stephen, I want to start in the beginning and ask you about how you got started in medicine, and particularly how you made the shift from what we might call a more traditional, what's your chief complaint? Let's get a diagnosis. Here's your prescription. How did you make that shift? But how did you begin in medicine to start with?
Well, my dad was a physician, actually a vascular surgeon, and he would usually leave the house about 5 in the morning and get home around 9 and 10 at night. And if I wanted to talk to him, or if I wanted to go spend the night at the neighbor's house on the weekend, my mom would say, go ask your dad. And so I'd have to ride my bike to the hospital I was a kid. So probably starting at age 8 or 9, anytime I wanted to see him, I'd ride my bike, and I was pretty trained that I could head up. Usually I started in the surgery suites, and that's where he was most of the time. So I would scrub up, put on a gown. They were all way too big, have gloves and a hat and a mask. And the head nurse would always watch me scrub up carefully. And to talk to my dad, usually I had to stick my hand in or, put in a stitch here or there. And so if he wasn't there, he was in the intensive care unit. And, I might have to pull out someone's NG tube that was down their nose into their stomach, so I was just a kid. I mean, fortunately, that's totally illegal. No one could bring their child to the hospital today. But in the 1960s, if your dad was like the head surgeon, all sorts of stuff would happen. So, but I had a very different impression. The hospital staff, the patients, they worshiped my dad. But I thought it was terrible what we did to people in a hospital. We tortured them and they suffered afterwards. And I can remember doing, on Saturdays, home visits with my dad, on wound changes, and I was like, I couldn't say it to my dad, but I thought it was kind of awful the way we tortured people in the hospital. So I grew up wanting to be a doctor that kept people out of the hospital. And through medical school, I think I was an anomaly. I was the only person there who wasn't excited about working in the hospital. My goal was to keep them out. And I managed to maintain that through my whole career. The idea that we can help people be healthy and vibrant with lifestyle choices, so they don't need most of the things that modern medicine, invasively offers.
So with that goal, how did you begin learning how to keep people out of the hospital? I mean, tell us the journey of step-by-step learning. Well, this is a better way.
Well, medical school is a bit frustrating for me, and so was residency, but I was fortunate that I spent much of my early career working in third world hospital settings, like in Kenya or Ecuador, or India, Pakistan, China. I realized that most people overseas, if they weren't starving, were a lot healthier than my patients in the US. And it was because they eat real food, they were active, and they weren't stressed out. They might have been stressed over, a hurricane or, lack of money, but they weren't stressed over the things that we tend to stress over. They were managing their stress, through social connections, and whether it was religion or meditation or something, they managed their stress. They were active, they ate real food, and they were just so robust and healthy. I was startled by how healthy most of my patients were. So when I started early on in residency, focusing on getting them to eat well, to be active, to, use prayer or meditation to manage their stress. And I had really good results and started doing studies, 20, almost 35 years ago. So it's been a long path, and over time I've gotten better at it. I've got my message simpler and easier to follow. And I've been tracking results and getting amazing results with my patients, literally helping them be 10 years younger, tune up their heart, and improve their brain function.
So if I were to come to you, which I have, and said, I want to make sure I don't have a heart attack and I want to live healthy for a long time, tell us the process that you would take one of us through.
Well, we would assess your food intake, your nutrient intake, your fitness, your using heart math, your ability to get calm and relaxed. We would assess your resilience and your lifestyle. And then we'd compare it with how you're aging. We'd look at your arterial plaque age, your brain processing speed, your bone density, and some really important markers. Like I would say probably, insulin resistance and inflammation are the two biggest scourges in our society today. Insulin resistance, is the number one cause for both heart disease, memory loss, diabetes, probably cancer. And inflammation accelerates all aspects of aging, and those are very heavily dependent on our lifestyle. So by targeting age factors, lifestyle choices, and some markers, like fasting blood sugar and CRP, high sensitivity CRP, and other inflammatory markers, it's been very easy to do the research and be able to predict which lifestyle choices help you stay young, and if you hurt yourself, to turn back the clock and reverse some of the damage. And, identifying which things could we do have the biggest impact, the biggest bang for your buck if you're going to make changes. So when you can show people like yourself, these choices result in this aging process, and these are the markers, and here's how we could do so much better. I mean, my big question usually to my patients is, would you like to be younger, trimmer, fitter, mentally sharper, have a better sex life, feel better, and prevent heart disease and memory loss? I mean, would you like to that? And most people say yes.
Yes, that's true. So Gina, I'm sure you have some things that you want to comment and ask Stephen about, just as you're thinking from Texas on the same things that he's doing in Florida. Chime in.
Yes, so thank you so much for being with us tonight. And I'd like to ask you how you incorporate. I'm thrilled and think it's very much a novel approach that you're a nutritionist and a chef. So tell me how involved you get. I've read some of your books and followed some of your recipes, and they're fantastic. But how do you speak to the patient about that? Do you actually talk to them about that, or do you now have a nutritionist or a chef that actually helps them with meal preparation?
We do a 3-day food diary on anyone who comes in. 2 typical work days, and I don't want their best day and I don't want their worst day. I want typical 2 work days and 1 weekend, because that's a very good reflection of how people eat. And then we look at their supplements they take, if they're taking any, and then we analyze nutrient factors, fiber intake, long chain omega-3 fatty acids, magnesium, zinc, all, we look at what are they getting, and we compare that with those aging markers. And so we do dietary analysis, and we do it every year. And when someone says to me, I want to skip nutrition this year, my usual line is, well, then you don't need to see me. If you're not concerned about, are you meeting your nutrient needs, then I don't really have much to offer you. We're going to measure your fitness. We're going to assess, are you able to get calm? And we're going to look at the food and nutrient intake you get. And that's the main emphasis that trilogy there of assessing how people are doing. And then, yes, of course, we look at advanced lipids and markers of inflammation and insulin and fasting blood sugar and, genetic to all these other, extensive part of their evaluation. But I think the most important part is to look at their food and analyze their nutrient levels and their fitness. I mean, that's the key to me.
Yes. Excellent. And then what would you say has been the greatest either technological or pharmacological or the greatest advance that you've seen happen in your career? When I first started out as a new RN in the late 1980s, we thought stents were going to save everybody's life. Fast forward to today, how ridiculous was that? You're treating one little inch of the entire, of course, vascular tree. So is there anything that you would say, wow, this is really a game changer, or maybe there's more than one thing?
I think I would say the two big, I kind of alluded to that before, the two markers of accelerated aging are really insulin resistance, metabolic syndrome, and in elevated inflammation. I mean, those two are essential to health. And, and when we think about lifestyle, when we think about inflammation, the number one cause of inflammation is probably your gut. The lining of your gut and the gut microbiome and the health of that. But the number two is the perioral cavity. That gingival lining is probably the second most important cause of inflammation and the easiest way to reduce it and make a big difference.
Yeah, fantastic. How would you say your philosophy, if at all? I mean, you were an early adopter, an early educator for all of us on the good fats, obviously. But how has your recommendation on nutrition changed since the Pritikin days?
So let's go back. So thank you for that. But, I got suckered into the low fat theme as well back in the 90s. I saw Ornish's work and Pritikin's work, and they had some impressive results. But the problem was I was the clinic section chief in Washington State for about, a 40,000 patient based setting. And I was trying to offer an Ornish program to our high risk cardiac patients, but less than 5% were even willing to try it. So I didn't realize at the time adding smart fats would be better than a very low fat diet. But what I realized is you can't get people to do it. They feel depressed. Their food doesn't taste good. And I didn't realize depression was really physiologic and caused by low fat intake, and it impacted their brain. So that, when it occurred to me, so when I shifted from the low fat, otherwise eating healthy food to a Mediterranean eating style, that was really powerful. And one of the most important studies was the Mediterranean diet study that was published back in the early 1990s, where it was more important to follow a Mediterranean diet than it was to put someone on a statin or to give them aspirin. And that was for me like, wow, the food we make is more important than drugs or procedures. And it's just grown since then over time with more and more studies and more data. And I think now we know that a Mediterranean diet is really one of the healthiest diets for blood sugar control, for your heart, for your brain, for longevity, all of that. So, and it's easier to follow. It's been rated 5 years in a row as the easiest diet on the planet to follow and the healthiest diet. So I like going with what's easy and what's healthy.
So I want to interject here because I forgot to mention something very important. And that is during the beginning of COVID, Stephen and his wife, Nicole, who's a wonderful RN who's worked by his side all these years. Stephen is actually a sailor, and they went to France, I believe, first, and you can tell the story, and ended up, poor things, getting stuck on a sailboat in the Mediterranean during the COVID crisis during that time. When everybody was in isolation, they were isolating in Europe. And tell us a little bit about some of the things that you looked into there relative to the Mediterranean diet, which actually led to a book that you wrote that's called the Mediterranean Method, which is actually an improvement over the traditional Mediterranean diet because of a few tweaks. So first of all, tell us about your experience sailing around for almost a year during the pandemic, and then what came out of that as far as your research?
Well, we had 3 almost 6-month periods where we sailed down the Atlantic coast of France, around Spain and Portugal, and into southern Spain. And then the next year was Spain to Turkey. And then the last year was Greece back to Spain. And we were, going from small port to small port for a year and a half in total, looking at recipes, shopping in markets, and I was online exploring, health benefits of the Mediterranean diet. And there were several published studies that showed that if you followed a Mediterranean diet, you were far less likely to have cancer, heart disease, memory loss. But if you did a low glycemic version of it, you cut out the sugar, you cut out the flour, and you focused on foods that didn't raise your blood sugar, mostly vegetable, fruit, beans, nuts, seafood, olive oil, spices, and herbs. If you did that with a little bit of dairy and organic poultry, you got a better result than just the Mediterranean diet. So it was that combo of a low glycemic version of it that was shown to be the most effective. And that's really what my book focused on and tried to help people. How could you do that? What are easy recipes? What are easy, it's focusing on foods you should eat more often. And, so I'm helping people identify, okay, of 30 foods you like, if you like 15 of them, then eat them more often. And that's a very easy thing for people to do.
Okay. Well, you're kind of leading into the discussion of nutrition and diets, and I put that word in parentheses. So there's a number of very popular diets out there, and I'm sure everyone's really interested to know the real scoop. And so could you go through some of the diets and your opinions about different diets that are very popular today?
Well, I think falling in popularity was the low-fat diet, the Ornish diet, the Pritikin diet, the Esselstyn. They've always been healthier than the average American diet, the SAD, standard American diet. So they've always been healthier than that. But were they really optimal? I think we've done now randomized clinical trials and seen that by adding olive oil and nuts, that we got better heart outcomes, we got better blood sugar control, and we have better cognitive results. So especially when you deplete the brain of fat, it seems to be hard on your brain and your blood sugar control. So I think that's been slipping. Paleo, has become a recent fad, but doing paleo right is really challenging because if you're really cutting out carbs to a large degree, most of your nutrients, plant-based nutrients, come from vegetable, fruit, beans, and cutting those out or reducing them severely has really impacts on meeting your nutrient needs. And it makes it really challenging. And you end up acidic. People who eat lots of animal fat and don't eat enough plant matter tend to be more acidic, and that ages them as well. They even sometimes are more inflamed. So even though it's helping with their blood sugar. So I think if you were trying to follow a paleo, I've known a couple colleagues have gone the right way about it, but they're talking about you need to eat actually about 9 cups of green leafy vegetables a day. And that's probably, again, like a ultra low fat diet. There's probably only about 5% of people who are willing to do that. So could it be done? Possibly, and be in a healthy way, but it's really challenging and most people aren't going to do that. They're just going to eat bacon and cheese and skip the vegetables, and that's not going to work. And then I think the other third large group is that Mediterranean diet, which we've been talking about. And my focus is really on a low glycemic, cutting out the bread and the crackers, cutting out the sugar, and really focusing more on a lower glycemic version of a Mediterranean diet. And that's probably the easiest diet to follow. It's been ranked by the US News and World Report 5 years in a row as the best diet on the planet, the easiest diet, the best for your heart, and the best for elevated blood sugar levels. So I would lump them into those three groups primarily. I mean, there's others you could ask about, but that would be how I would point them out.
Mm-hmm. So if you had a diabetic patient come in, tell us a little bit about the discussion you might have with them about how to try to reverse that, and maybe even get them to the point someday where they don't need medication.
Well, clear back in 1995 was my first dietary intervention and exercise trial for diabetics. We took people who had a hemoglobin A1C greater than 8. Many of them were on insulin. They were all on meds, and they were all falling apart. And within a few months, almost all of them were off of their meds and had normal blood sugar levels.
Mm-hmm.
And we focused on adding the right food, taking a decent multi every day, getting activity every day. And it was hugely successful. It worked. So over time, I felt more and more confident when I see someone with diabetes. It's like, would you like to have a normal blood sugar level, feel dramatically better, and not need any medication? You know, I think most people with diabetes, they're exhausted. The elevated blood sugar toxic state makes them inflamed, depletes their vitality, their energy. They've forgotten how good they could feel. Mm-hmm. So the biggest challenge is giving them the confidence to realize they could feel terrific if they were willing to try something for just a month. Mm-hmm. Mm-hmm. And you know, would you like to get your life back, your sex life back, your energy back, get off your meds? You could feel so much better. That's the message that they've been waiting to hear. And not all of them, but most of them, if you get offered in that way, with a plan that's achievable and has worked, are willing to try it.
That's good. We hear too about blood type and nutrition. Can you comment on that?
You know, I read through on the blood type diet, I read through the references, and there was really almost no references that actually supported that book, the statements in it. So I'm sure there's some genetic components and tendencies, whether you're A positive or not, A or O, you know, positive or negative, but there might be something there. But I think far more important than the blood type diet is to look at people's food sensitivities. Mm-hmm. If you are sensitive to gluten and you keep eating gluten, that's tragic because it can cause really substantial harm to a person. So if I should have probably put a fourth diet category in there, and that would have been an elimination diet. I wouldn't have suggested a blood type diet, but I would have said and I've written this in I think all my books, that anyone who has chronic health problems and can't seem to overcome them, to try an elimination diet for at least a month and see if they feel dramatically better by giving up gluten, dairy, corn, soy. I'm not saying no one should, nightshade plant food. Not everyone doesn't need to give those up. But if you're gluten sensitive and it's causing inflammation and leaky gut and elevated blood sugar and depression, and people are in a terrible, states sometimes because they're eating foods that are potentially addicting to them. Mm-hmm. And cause substantial harm and inflammation through a sensitivity. So I think a fourth dietary plan that's very important is to offer anyone with chronic, unexplained health problems a 30-day elimination diet. Try to get them through that and see how much better they can feel. And so, I mean, I've had people almost in a wheelchair who were drooling with multiple sclerosis, and we took gluten away and everything cleared up.
Wow.
I mean, it's like night and day, phenomenal.
Amazing. That is amazing.
You know, people who had rashes all over their body, artery inflammation, brain fog, and they gave it up and they just totally were healthy and vibrant.
And how many physicians in the country are actually doing this kind of testing? Not many.
Maybe 5%.
Yeah. Yeah. And would they call themselves functional medicine physicians or nurse practitioners or integrative physicians? Is there title you prefer?
I think functional is, I like that term because you're focusing on someone's function and state of well-being.
Yeah. Yeah.
Integrative is trying to, and I like both. Integrative is we're trying to use allopathic medicine. Like if you're in a car wreck with trauma, you don't need herbal tea.
Yeah.
You don't need a diet change. You need a surgeon, you know? So we're really good with like car wrecks and trauma in allopathic medicine. Or if someone's, you know, had like a heart attack and you're trying to reverse that immediate process. We're terrible at managing chronic illness with people just gradually, slowly getting worse.
Will you share with everyone the illustration you use about the car going along the cliffs and going off the cliff, and the difference between traditional medicine and what you're
traditional medicine is there's a tight curve at the top of a hill, and there's no guardrail and there's no slow down sign. So they built an emergency room right at the bottom of the cliff. So when they crash, they're there to fix them. That's not dealing with the cause of the accident. It's the turn. So, you know, so I've said this, you know, or I mean, the analogy I've used in my clinic, I don't know if I used it with you, but I've used it dozens, if not 100 times, is you're driving on this road. It's really smooth and comfortable and you like it and you're just happy as a clam. And you see me at the side of the road with the sign saying, stop, stop, turn right, because the bridge is out and you don't realize it. And if you go straight ahead, you're going to go off the bridge and crash. You need to detour and make a change.
Do you see there being a change in medicine ever in the future in the Western world?
There's many, and like, you know, if we were to take funds from the emergency room and put that guardrail at the top and a slow down sign, and, you know, it's taking money away from them. So the people in the emergency room are going to fight that.
Yeah.
It might make sense, but that's what they do. That's what they believe in. So every time we try to change what we're doing, we have resistance. We spend 90% of our financial resources for heart disease on procedures and hospital care. Of the 10%, most of it is spent on drugs and lab testing. Hardly anything is spent on lifestyle, to change people's lifestyle. And the hospitals fight tooth and nail when we try to reduce their budget and put more into prevention. Not that they don't believe in it, but they don't want to give up with what they're doing.
I have heard something encouraging that I think it was Blue Cross of Florida was now any patient that was diagnosed with type 2 diabetes and getting medications was also assigned sort of a health coach. And if that would be a positive move.
It's probably financially beneficial to them. It's probably saving them money. And it's about time. I mean, so I said about 5% of physicians are probably actively involved in, you know, full functional medicine. but I think there's growing interest. I think many physicians would like to be able to get more, but the current system doesn't pay them to do that. I actually have a little more hope in the dental community than the physician community. Dentists are talking about, the mouth, that's where you first meet food. Well, I guess you smell it first. You see it and you smell it and then you taste it. But I mean, and dentists do have the time, especially the hygienists. I think hygienists have a huge opportunity to talk about the right food while they're, doing that cleaning. Instead of, putting on a headset and having listened to music, they could listen to your spiel on, are you getting your top 4 nutrients like vitamin D and magnesium and, fish oil, are you meet these needs? Do you eat these foods? They could, seduce people, during that time. And it's a really, I think, a powerful opportunity that we could expand on. I have more faith in the dental hygienists than I do the physicians. I just think there's more, it's more realistic for them to get the message across.
Yeah.
I do hope over time we will shift more towards prevention and lifestyle, but I haven't seen it in my career, much of a shift yet. It's been very gradual over time.
And I want y'all to know that are with us tonight that we've asked Stephen to become part of our teaching team, and he's graciously accepted. And so between his knowledge and Gina's, we feel like we're going to really be able to share with you, to share for your own health and for the benefit of your patients, great advice. I want to ask a couple of questions about vitamins and supplements, and then kind of open up the discussion to everyone else that's been listening in, anything they would like to ask you about. But you mentioned a few a moment ago, but tell us what your thoughts are about vitamins, about supplements, about everything that used to be hippie nutrition that now we're realizing is real food and necessary, particularly if we have a depletion of these things in our natural resources.
Well, in our clinic, I told you we looked at nutrient intake and supplement intake. And so we were able to analyze how many milligrams of magnesium or long chain omega-3 fats or zinc or, fiber were they getting per day. And we could compare that with, was their brain speed were improving or worsening? Were they growing plaque or was their plaque shrinking? And we published several studies that looked at nutrients are much more important in predicting heart disease, your nutrient intake, than your cholesterol level. I'm not saying cholesterol isn't important because it does play a role, but whether you're getting your zinc and magnesium and omega-3 fats and vitamin K and vitamin D are more powerful predictors of both preventing plaque growth and, if you have it, shrinking it. So these nutrients are critical. We did the same analysis with brain processing speed and found that several nutrients like mixed folates and long chain omega-3s and your blood sugar levels and B12, those were really important markers of enhancing brain processing speed and brain function and preventing memory loss. So I look at 4 essential parts of health: your food, your nutrient intake, your fitness, and your stress management. So yes, most people are going to need to take a supplement that could, depending on what they're eating, might include several ingredients.
Okay. All right. Laura, do you have some questions for Stephen?
I do, but I just want to say, you're speaking our language here with all of our, study club members. A lot of them are all dental professionals. We do have some medical side, and how I like to explain it is leaky gums is leaky gut, right? That epithelium all the way down. Really trying to bring together that if we're going to treat the mouth, just like you said, that first level of digestion, where's the raw to break down the gluten? Where is the nitrate reducers from our food to actually make that nitrite to make that nitric oxide. So love that, you're going to help pull a lot of this together, because I just want to say thank you for saying that to all the hygienists that I know are on. I see their names out there, to be empowered by what you're saying. I call it loving on them, as they have to listen to us with our hands in their mouth. But I love that you rattled off a lot of those nutrients, because that is important, right? We're talking about, I call it healing and sealing. We're not only talking about maybe eradicating pathogens or an infection, but then I say, that's a service, like you said, trauma, right? Or an infection, but how are we helping them, like you say, long-term, reverse that? I call it healing and sealing. So in the GI, I guess I'd like you to, I heard the 4 you said. I talk a lot about, the D3, the K2, making sure we get the K2 so we can mobilize that D3. But what were the 4? Just so I want my hygienists to hear that, because I do want them, I call it loving on their patients as they're talking about healthy fats, like you're saying, kind of educating that there's a shift going on, right? Talking about the brain health, the vascular health. What were those top 4? So we could all write that down.
Top 4 for what? There's different nutrients
I know,
for different
and there's
conditions.
a list. So if you want to rattle, I know.
So, I mean, if I was going to give you a gist of my overall top 5 or 6, it would be certainly vitamin D, because we don't get that from food. Unless you're going to eat 40 egg yolks a day, you'll never get there, and I wouldn't recommend that. Magnesium is one of the most common deficiencies in our diet today. Multiple things that help, between blood pressure, blood sugar, muscle cramps, constipation, asthma, brain function. So magnesium would certainly be up there. Zinc helps with blood sugar and immunity. So zinc would be in there. Long chain omega-3 fats are very anti-inflammatory and nourish your brain, and your brain is mostly made of them by weight. So for brain function, that's critical. Vitamin K helps both shrink artery. If you don't have vitamin K, the calcium goes from your bones to your arteries, and that's not a good way to do that. So vitamin K is an essential nutrient there. And I'm not just focused on vitamin K2, it's either K1 or K2. K2 is the more physiologic active form, but it's a lot easier to get K1 from food and let your body convert it. Those were like maybe my top 4 or 5.
Awesome. I think that's perfect. Just giving us some general kind of, having those conversations at the chair with our patients is so important.
So yeah, a good multivitamin provides much of that, a good quality multivitamin. Defining that's a bit of a challenge, but they should be minerals, not salts, so like magnesium glycinate and zinc glycinate and malates, something that's a protein bound. They should have organic copper, not inorganic copper. And inorganic copper in a multi increase your risk for cancer and memory loss and insulin resistance. So, that's essential. There's some tidbits we could look at as a good multi, plus magnesium, plus fish oil, plus vitamin K, although you could get vitamin K in your multi, but so those are just some of the key nutrient factors that I focus on.
So insulin resistance and diabetes, right? In the dental community, we know 80 to 90% of our diabetics have periodontal disease, right? It's that vicious cycle, that we kind of go through with the sugar feeding the bacteria increasing the inflammation. What's your thought on these continuous glucose monitors? You're seeing how popular they are. I know a lot of us use them in some of our practices. I'd love to hear, are you using that? How do you feel about that? Because it's kind of leading me to what we were talking about earlier. To me, that's a great way that I can kind of show somebody who's like about their diet, that maybe what they're eating their body necessarily doesn't like.
So a continuous glucose monitor, I think, is very a useful biofeedback tool for someone with diabetes. But here's the thing, if they really ate well, did their dental hygiene, were active, they wouldn't need to monitor their blood sugars. So it's kind of in there. So, but it does give them feedback. So if they have continuous, they can see after a meal or after a walk, the impact of their choice on their blood sugar level. So they're useful if you frame it in the right way. If you're, I mean, our big emphasis is on, are you taking your meds? And if not, then we have to add a new one. And then most diabetics are on 3 or, you know, they start with 1, but I mean, pretty soon they're on 2, 3, or 4 diabetic meds, let alone their statin and blood pressure control, because everything, when your blood sugar's up, your lipid profile is going to be out of whack as well as your blood pressure. So if we get back to basics, so yes, they should do continuous glucose monitoring to get feedback on how their choices impact them. And I'm not anti-medication, but my goal should be you shouldn't need them. If you're not going to change, take your meds. If you're really going to make substantial changes, the hope is you won't need them. And initially, the glucose monitoring can be useful for that.
Great. That's like, you know, again, just talking about tools, I call them, you know, tips and techniques that maybe we can talk about with our patients to just create awareness. Like that's what I said, feedback, you know, from Oura rings to glucose monitors. We've all this great technology. I love that you're talking about, you know, being leaky, toxic, the GI tract. We talk a lot about like heptoglobin, and I feel like there's a huge impact that we can have, again, talking about the food, like what does make us more leaky, how to get those junctions together, obviously not just in the mouth, but in the GI tract. That way, just maybe touch on that. And then you have lots of questions. I know I don't want to miss all these questions on diabetes, on some of the medications, but just for our listeners to kind of hear how important that is. I mean, we're talking about environmental toxins, right, that are make us more leaky. A lot of that is all in our GI. I call it, you know, I really believe
dietary sweeteners, you know,
right.
The pink, yellow, and blue packs can damage the gut microbiome and lead to more leaky gut. So they think they're doing the right thing by avoiding sugar. I mean, I'm more okay with like monk fruit or stevia or erythritol or xylitol in small quantities. But so yeah, there's many dietary and toxins. Think about the nitrates that people eat in processed meats, deli meats, bacon. Those are literally toxins to the brain and to blood sugar control. So many people have diets that are just plain awful. No wonder they feel so badly, you know, but we can, I feel blessed to be able to help point a straight line and help people avoid some of these pitfalls and make better choices.
So tell me your secret. As a care coordinator, you said that's the easiest one for me. And then I'd love for you to talk about the hardest one. But you said the easiest one is diet. And I love that you're saying that. I do love that talking about the healthy fats, because you said people have to be satisfied, right? They don't want to feel like they're missing out. And so Thanksgiving's coming.
But here's the big challenge.
Yeah.
I'm not telling people what they can't eat. My focus is not on what you can't eat, because telling people what they can't eat is not an effective message. We've studied that, we've tested it, and it doesn't work very well. I mean, there are some toxins we clearly want to avoid, but it's generally not the best message. Like even like, you know, but here's what we could focus on. Give them a list of foods. Like I had a common list of 10 years younger. I had a list of 16 foods, and I said, try to find 8 or 10 of them that you really like and eat those a lot more often. So give them a list of healthy foods and see which ones they like and eat more of them, as well as, you know, recipes. We've got to give people a choice, you know, menu plans. What could you eat for breakfast, lunch, and dinner? And give them choices to pick from. And, you know, most people over a month only use about 10 recipes. If you could give them 100 recipes and they could find 10 that they would like, and 16 foods that you want them to eat, and they would, pick at least 8 of them and eat them more often, that you have a big change in their eating behavior. That's much more powerful, we've noticed from our research, than telling people what they can't have.
I love that. Talking about insulin resistance, how do you feel about orders of food? We follow the glucose goddess, vinegar, maybe eating either that, the order of either your vegetables or that protein, giving our carbs, our starches, our sugars last. What are your thoughts on that?
So a little acid in your stomach decreases blood sugar absorption. It's really the food you choose to eat, though, that has the impact. When you eat a meal, whether you have your protein or your carbs, your fat, at which point in time, yes, if you save your carbs to the end, you're going to have like a 3 to 5% decrease in blood sugar. So you're not going to get much, you're making it much more difficult to eat a meal for a tiny benefit like vinegar. Yes, you'll get a small 3-5% improvement in blood sugar not being absorbed by taking vinegar ahead of time. If someone just liked a vinaigrette salad, you could just eat a salad with vinegar and you'd get that purpose done. So eat a salad with vinegar first is how I would say that. I wouldn't say you have to swig vinegar because most people can't do that. It's just not going to happen. So I try to focus on the foods they could add that help with blood sugar control. And generally that's vegetable, fruit, beans, nuts, seafood, some organic poultry. It's not that, and olive oil, extra virgin olive oil. It's not, I try to make it simple, as simple as I can, to have a bigger effect.
So I have to talk about the stress. We're heading into holidays. Good stress or bad stress, I still say it's stress. And there's a lot of stress for some people. Dr. Pritchard and I were talking about this today, just around eating, even if you're choosing to eat healthy, but you're going to go out to eat with friends, or we're getting ready to head into holidays. And that can just be stressful, just getting ready, let alone, like you're saying, all the stresses that we have here in our American lifestyle of just, how fast paced and how we go. What are some of your top ways, I guess I'd love to hear, on managing stress? I feel like we don't talk enough about it.
1, get enough sleep. Way too many people don't. And good quality sleep, not restless sleep, but you wake up refreshed. 2, you need a workout to burn off tension most days, preferably every day. And you also need you're not going to decrease your stress in your life. That's just not going to happen. A hurricane's going to come. Something's going to happen. There's election chaos. But we can proactively take 10 minutes. It only takes about 10 minutes of meditation or doing a software program like HeartMath, or, deep prayer when you're really in a meditative state, to have a large impact on reducing cortisol. And then affection and hugs and romance are also really good for the brain. They release oxytocin, which lowers cortisol, the stress hormone, and the relaxing bonding hormone oxytocin goes up. So sleep, exercise, 10 minutes of peace and calm, and some hugs, cuddling, and affection. If you don't have a partner, then get a pet and, pet your, pet. And, we need that. Those are my key tips for managing stress, because we're not going to get rid of it. I don't know how we can not have stress.
I love it. Thank you so much for sharing that. I know sleep is such a hot topic as you come into our IDM. I know we're going to be wanting to put all of that together, from our airway, breathing, our sleep, right? We look at these pathogens, and I say to plaque, but really how important these things are, what we call metabolically and then cellularly, because we haven't even touched on even how that relates to our cortisol and our insulin. So just love that we're opening these topics. Dr. Wilkerson, I'm going to kind of turn it over to you. We had lots of questions from
We do.
metformin and diabetes, so I want to make sure we get those answers.
Well, Tom's entered a few comments and thoughts, and so I'd rather, Tom, you just verbalize those and have a conversation with Stephen, and we'll listen in. I think you're muted.
Okay. Yeah. Thank you, Whit. Thank you, Steve, for all the excellent information. Please address the subject of metformin in non-diabetic patients. Some literature seems to be positive relative to its effect on mitochondria and ATP. I've read trials too where it's not so positive, and it seems like to me that you are pretty much against medications that are not necessary, but those that are advocating metformin as a quote longevity medication. What are your thoughts on that?
Well, metformin helps enhance insulin sensitivity.
Okay.
So that's 60% of Americans, probably have some degree of insulin resistance.
Yes.
So if you put everyone on metformin as a drug, you would cause a benefit, and you would also cause some harm.
Yeah.
With liver dysfunction and other issues. So you would benefit more than you would hurt, but you would hurt people.
Yes.
By doing that across the board on people who don't have diabetes.
Yes.
So you have to be very careful about that choice. Metformin, so it helps in unanticipated ways, like polycystic ovarian disease. They have a very tight capsule around the ovary. And when you improve insulin sensitivity, it helps that whole female hormone balance restore itself. And it's a fertility pill. People are more likely to get pregnant if they're infertile with this condition if you put them on metformin. It can enhance brain function, especially insulin resistance really shuts down brain processing speed. And we've shown in our clinic how important it is to get blood sugar back to normal to enhance the brain processing speed itself. So my goal is, if someone's not going to make the dietary and nutrient choices I would recommend, I think, adding magnesium and omega-3 fats probably could potentially, and zinc could have as much or more benefit than metformin.
Got it.
Without the side effects and many other side benefits from meeting those nutrient needs. So that would usually be my approach. I would never take someone off their metformin if they weren't eating well and their blood sugar levels were elevated. I might be more likely to add another diabetic med, but I would hope to give them the tools so they didn't need it.
Good. Thank you for that. For those of us who are following a model very similar to what you are doing, we're not insulin resistant, and we know don't have arterial inflammation, and we're doing the right things, and maybe our diet is not exactly right. You would typically not put someone like us on a metformin unless there was a specific need for that.
I would certainly give you a trial of lifestyle first.
Got it. Got it. Well, let me ask one other question too. As far as practicality, I know your books are very practical. One I have found very practical too is William Lee's book, Eat to Beat Disease. Are you familiar with his book and the information that is in there?
No, I'm not.
Well,
I'm trying to see the author there.
Yeah, William Lee, and he really goes into great detail on every type of food and the ingredients and the assets relative to immune response. And as he calls the phrase there, our bodies are really designed to protect ourselves if we eat the right types of foods. And I know that's a lot.
Certainly believe that.
And that's exactly what his book is about. I know your books are very good, but for those that are looking for specifics relative to the types of foods, nuts and berries and so forth, this is an excellent book, very thick book, but it's a very, very scientific book, and I would certainly recommend that.
Okay.
That's all I had, Whit. Thank you, Steve.
Yeah.
You're welcome.
Let me ask you, just because before we wrap it up tonight, I want people to have resources to go to, because we're learning so much, and obviously we can't take it all in and know what to do with it until we go find the answers that you provided. So help us know more about what we can learn from your specific books. So the Better Brain Solution, tell us what that book is about, what the focus is, and what we can learn from it or share with our patients.
Okay, so first I'd say the website, drmasley.com, drmasley.com, one word, Dr. Masley,
Okay.
no dot in the middle.
Oh, okay.
I have blogs on a host over, hundreds of topics that people could look at, and recipes. I put out, in a month, I usually have 1 or 2 recipes, 1 content blog, and like this one was on drinking tea. What are the health benefits of drinking tea? Pretty substantial, even black tea, the most recent powerful studies. So I did a blog on that. And sometimes I'll mention other people's programs. So there's that. On the books, my top 3 Better Brain Solution is really how to enhance your brain, how to have better, be sharper, quicker, be able to get more work done, be able to pay better attention. There's many things we can do that help our brain and help prevent the scariest disease in America today, which is Alzheimer's. So we can prevent most of that. If we just got rid of insulin resistance, we would probably eliminate 60 to 70% of Alzheimer's just in a sweep. It'd be amazing. 2, the Mediterranean method you mentioned. I think for someone who's just looking at what could I eat and make it easy, that's my easiest suggestion as to how to follow a Mediterranean eating plan that's has a low glycemic approach. And the third, the latest book, the 30-Day Heart Tune-Up, really shows you how to stop arterial plaque growth and reverse it, enhance your circulation, enhance your romantic sex life. I mean, because romance, sex, and circulation, they're all in, it's more obvious for men that if you don't have circulation, your sexual function might suffer, but it's equally true for women. And we missed the boat on that, lack of pleasure and dryness and other things are really related to nutrient intake and our lifestyle choices. We can make a big impact for both genders. So, but preventing heart disease, it's the #1 killer for men and women, and feeling better. And when your circulation's better, you feel better, you have more energy. So those are the 3 books I tend to recommend most often. So, and those were depending on who you might be thinking about, when I might recommend one or another.
And all of those books have multiple recipes.
They all have at least like 60 recipes.
One of the things that's so wonderful about your books is the fact that it introduces concepts, but it's not primarily just about teaching concepts. It's about implementation of now what, and how do you begin today to do these things, step by step. So I think that would be extremely invaluable to all of us as we're trying to catch up with you. We have the resource of your input right to us immediately. So that's tremendously helpful. I want to try to open up in the last few minutes that we have questions from others that are on the call, and there are some questions in the chat. Let me see. Well, Dwayne says, I have so many diabetic patients that when I ask what their last A1C was, they'll tell me 6.6 or 6.9, and that their doctor is super happy. And how do I get them to understand that that's still maybe too high?
Well, that means from a medical perspective, they have controlled diabetes. They've met the control goal and they're falling apart and aging rapidly. So yes, you've met the goal for drug therapy, but you're going to fall apart and feel terrible if that's what you live with. So much better to have controlled diabetes than out of control. So I congratulate them. It's so great you've done that. but would you like to be normal and not need medication? That would be the next step. And have a life filled with vitality. Instead of controlled diabetes means you're going to have accelerated aging.
Okay.
That's, I don't think they're usually not aware that they could get, so most medical doctors are never going to mention you could be normal without medication. They're just happy that they got a diabetic at target control, which is hard to do. If you follow the sad American diet, it's very hard to get blood sugar control with drugs.
Holly asks, she says, as we look to consider zinc in patients that we've done our salivary testing for oral pathogens on the HR5, are there contraindications with zinc and lupus? I had a patient that thought that, but I'm unsure.
Well, zinc has like selenium, zinc, there are minerals out there that have a J-shaped curve to them. If you're not getting any, your health is your problems are gonna drop when you add the right amount. And if you add too much, they're gonna start getting worse again. And zinc really can give you like stomach distress. You know, too much of a good thing is still too much. So for zinc, I'm looking at usually 12 to 15 milligrams for men, women, up to 25 milligrams, and usually not more than that. So some people, if they really healthy, might be getting 10 to 12 milligrams a day. And if they're in super health, that's probably enough. But most people are going to need somewhere between 15 and 25, but not more. I mean, you know, magnesium is the easiest one. If you're really low, you're probably constipated. If you really overdo it, you'll have a major laxative effect. You can titrate it almost from that alone, you know, but so yeah, there are some, you don't want to overdo nutrients, but I'm not worried about giving someone with lupus, an autoimmune disease, a modest amount of zinc. I think they need it.
Okay. Well, when we were together in Chicago in February, Stephen spoke at the American Equilibration Society, and I grabbed a microphone at the end and went around the audience, and people started asking him questions. And I mean, we had to cut it off. But one of the questions that was my favorite was that there was a Cajun fella there from South Louisiana, I think around Homa. And he said, Dr. Masley, he said, how about crawfish? Is crawfish healthy? And Stephen said, well, I think cold water crawfish would probably be good. I'm not as sure about warmer watered crawfish. And he shot back to Stephen and said, well, Dr. Masley, let me ask you this. What if you drank a beer with that warm
cold beer,
crawfish?
cold
beer with that warm crawfish? Would that make it healthy? And Stephen was stuck because he knew that this fellow probably, his main diet was probably a cold beer. But anyway, it was hilarious. But I know that you all probably have some questions that you'd like to ask. Specific foods, you know, are avocados really okay? Or are they bad fat? That sort of thing. Certain things about supplements or different supplements or vitamins and how much is the right amount. So if you want to chime in, I'll kind of moderate this. And I want our host to chime in too. So if you all have something in mind you want to ask about, how bad, I'll ask one, how bad is it to eat farm-raised fish as opposed to wild fish like salmon?
Well, you have no idea what toxins might be in it. I mean, it can be substantial that when we feed animals toxins, that they'll have toxins in their system and be harmful to us. So it's not just fish, you know, so it should be wild fish, not, now, farm-raised fish, we might be fine. Like if you were down in southern Chile and the only thing they fed their fish was herring that they caught, it would be great. But usually it's soy and corn that are covered in pesticides, and maybe they're throwing in hormones as well to stimulate growth. And they may even throw in some sources of sugar to help accelerate. You know, it's like crazy. And so it should be wild caught fish, but likewise, it should be for beef and poultry. It should be organically raised, cage-free, who are not fed grains with pesticides, toxins, herbicides, and other chemical compounds. So organic, we get about 80% of the toxins in our diet from meat, poultry, fish, and dairy. 80% of our toxins come from that. So when you talk about organic, it's not about the fruit and vegetables. If you really want to lower your toxin intake, we should be looking at organic animal protein, particularly.
So there's, I know you've researched this. So we talk about silver amalgam fillings and people with mercury toxicity. And I know you've seen patients with elevated mercury levels. What do you think are the major sources of people becoming toxic from too much mercury?
Well, the biggest source is big mouth fish, grouper, tuna. I mean, fillings will, if you, as we know, every time you add one more filling, we can measure it in your urine and we can measure it in your blood, and there's higher levels. And as they wear and break down, they release more mercury and we have higher levels. So, you know, there's been data published that if you have more than 6 or more than 8 amalgam fillings, your mercury levels keep going up. But we're talking, you know, a few points, which on a population level is a lot. But, you know, so if we're talking, you could raise your perhaps 4 to 6 points from amalgams. People can go from 10 to 40 by eating too much big mouth fish. Dramatic. So big mouth fish, tuna, grouper, large snapper, swordfish, shark have very high amounts of mercury, and they're the largest source of mercury toxicity that we get. You know, so yes, it'd be better for people to get rid of their old amalgams and avoid putting new ones in, but the big mouth fish is the biggest impact.
And interestingly, there was another study I was looking at put out by the wildlife researchers that they found that largemouth bass and catfish in streams, lakes, and rivers were very high in mercury.
Yes.
All through the Southeast United States. It was extremely off the charts high.
The bigger the mouth, logarithmically, the bigger the mercury content. And
so,
bass, yes, are right up there too. Thank you for mentioning the bass.
Yeah, so it was recommended that anyone of childbearing age avoid it altogether. And those that are not of childbearing age, try to limit to maybe once a month, something like that. We're talking about catfish, largemouth bass, that sort of thing.
From our clinic, the big jump is when people had more than 2 to 3 servings per month is when we saw a jump in their mercury level. Most people could eat grouper once a month or tuna once a month, but once they hit weekly, that's where we really saw it go up exponentially.
Janet asks, what's the best type of magnesium supplement?
So some protein-bound source like magnesium chelate, magnesium glycinate, magnesium malate. When they're protein-bound, they have almost 50 to 100%, you know, double the better absorption. So, and when they're in your gut, not being absorbed, they can be GI irritants. Like maybe the worst source would be magnesium sulfate, in that it can be a GI irritant and it's not as well absorbed.
Tom, Laura, Gina, anything you want to jump in here, because we're running out of time very quickly. And I'm sure Stephen is thirsty and tired, so we got to keep it going here.
Good. That's very informative. Thank you.
Good.
I would like to hear your opinion on intermittent fasting or fasting in general.
Yeah.
So my favorite breakfast is no breakfast. But you don't have to do it every day. I mean, so some people are fasting every day for 15 hours, but at least when we look at clinical studies, we have shown that if you do an intermittent fast 2 to 3 days a week, you get almost the same benefit you do from fasting or, following a paleo-like eating plan. So I think the minimum, we should all probably go 15 hours without eating 2 to 3 days a week. And if you feel better, by all means, feel free to go ahead and do it every day. That means like one example would be 9 p.m. to noon the next day. Try not to eat after 9 o'clock at night. Don't eat. You could have tea or coffee, just don't sweeten it. Black. That would be fine. And from midnight to, from 9 p.m. to noon the next day is my favorite 15-hour schedule. You could do others, but that seems like the most practical, easy one to follow. So I highly recommend that 2 to 3 days a week.
Okay.
What's happening physiologically that's beneficial with that? What do we change?
Well, when we're eating and we're absorbing nutrients, we're in a energy production mode. We're oxidizing ourselves when we're doing that. From a scientific perspective, as an example, when you fast more than 12 hours, your body starts removing amyloid from the brain. And right after you eat, you're forming amyloid in your brain, this inflammatory protein. So people at high risk for memory loss, excuse me, my voice is starting to go.
Yeah.
So people with memory loss are, really benefit in particular, but also insulin resistance improves with prolonged fasting. So that's 60% of the population are going to do better by giving up breakfast 2 to 3 days a week, a 15-hour fast to improve their insulin sensitivity. And, so we still need all those nutrients and we need that fiber. And if you are going to eat breakfast, then I usually recommend, like a veggie omelet with organic cage-free eggs, or a smoothie with cherries and plant protein and almond milk, so something unsweetened, but sweet from frozen cherries. So those would be my 2 favorite breakfasts after not eating breakfast.
Mm-hmm. Okay. Great question. Well, you know what? Why don't we wrap it up? Because you've given us enough information that we'll never digest all of this. But I want to talk about where we're going here in the future. We will have a meeting the first Wednesday of December, from 8 to 9:30. We'll send you a notice of our study club meeting, and please invite your friends, your hygienist friends, your dentist friends, your nurse practitioner friends, and others to participate in this. We're going to have stimulating conversations like this every time. And Stephen, thank you. You may have overstimulated us, but
I just saw the egg question. I think organically raised, cage-free living chickens produce eggs that are healthy to be eaten. They don't raise your cholesterol in a significant way.
Yeah.
They have smart fats in them. They have protein, so eggs are one of those elimination diet things you need to try, because egg whites can cause sensitivities. So anyone with a chronic unexplained illness should try giving them up and see if they feel better. But for the rest of us, I think eggs are quite fine to have a few days a week.
Yeah, good. So we put in the chat the link to the IDM Scholar Society Study Club. Please share that with your friends. And we want to get 1,000 people on this, so we're not shy about inviting new people. Also, we have coming up this month, and you've probably received information on this, but we have our inflammation infection workshop that'll be virtual. So that'll be on Friday the 21st and Saturday the 22nd, from 9:30 to 3:30 on Friday, and from 9 to 1 on Saturday. So the link should be there for that as well. And please join us for that. It's going to be really great. We're going to get into all the details of salivary testing, non-surgical periodontal therapy, inflammatory factors systemically that we should all be familiar with, interpreting those, and then what strategies are used that Gina and Stephen are using for treating these systemic inflammatory problems. So that's going to be a great, insightful course, and that'll be taught by Laura, Gina, and Tom and myself. Then in January, we have our foundations course, which is 2 days here in St. Petersburg. The purpose of that is to lay the groundwork for the different aspects of integrative dental medicine, which is inflammation and infection, oral and systemic, airway, breathing, and sleep disorders, and TMD and occlusion. So we're going to cover those in that seminar. And so we want to invite you to that. That's in January. And then one other thing I want to mention is in April, and Stephen will be joining us in person for that meeting. And that is April, I think it's 20th and 21st, but that will also be in St. Pete, and that will be called the IDM Revolution or Symposium. And so very much like the AOSH meeting that so many of us attend in September, in April, we're going to bring in heavy hitters of research and new ideas, and those that have been very successful clinically in their practices and integrating these things. We're bringing a huge group together to share with you what they're doing, what they're learning, ideas that you can take home, from marketing to implementation to education to motivating your patients, and new systems that you can implement. So that will be in April, and that's listed here as well. So until we see you either at the inflammation course, which I hope all of you will be with us for that, or in December when we'll have our next study club meeting. Thanks for being with us tonight. And thank you, Laura, Gina, and Tom, and Kim. And thank you most especially, Stephen, for being with us tonight and taking time out of your busy schedule to share with us. We sure
Night,
appreciate
everyone.
it. Night, everybody. Take care.